Right, guys, this is the whole map of England, Scotland, Wales, Northern Ireland, and Southern Ireland. 1,500 cases, 43 people with corona. UK deaths 55. And there's the virus. So, yeah.
Really sobering reading, actually, Colin. This is from the Imperial College COVID-19 response team. They're the ones who've been advising.
Prime Minister Boris Johnson says we need people to start working from home.
We are in for the long haul here. They're talking about how they have changed their minds in the last few days based on what is happening in Italy. They also say demand here early.
Italy's got it bad. Like 5,000 people have died there.
High on hospitals than they had been anticipating, with a high number of patients being admitted to intensive care and a high proportion of those dying. So they have redone the maths. They are looking again at what is likely to happen here in the UK. And I have to tell you, Colin, that they are talking about, even with the kind of measures that we're hearing about today, that they're predicting that they might reduce the peak critical care demand by 2/3 and half the number of deaths. But even with this optimal mitigation scenario, you're still looking at an 8-fold higher peak demand on critical care beds over and above the available surge.
They've got a shortage of beds in the UK, shortage of ventilators for people for coronavirus,
in the most
and everything else.
Favourable scenario, there would be in the order of 250,000 deaths in the UK based on that strategy. Now, what they're saying, that the only possible conclusion is that epidemic suppression is the only viable strategy at this time to, in effect, stop the virus circulating. That would have to go on until a vaccine was developed in 12 to 18 months' time. And that the social and economic effects of those measures to achieve that policy goal will be profound. It's hard to underestimate the significance of this document.
Thomas, I'm sure it'll be featuring heavily in the newspapers and elsewhere tomorrow. That's really sobering indeed, isn't it? Thomas, for now, thanks very much indeed. Let's turn to our political correspondent, Kate McCann, who's had sight of that as well. 250,000 deaths, best case scenario.
And it underpins why the government has shifted its response. We knew last week when Boris Johnson announced those measures that you ought to self-isolate if you were showing symptoms for 7 days. We knew then that there was the potential for this to change. We didn't expect perhaps that it would happen so quickly. But what is clear from the document that Thomas is talking about is that those assumptions have changed over the last couple of days. And that's why we're now seeing a move to increasing social distancing, to people isolating for 14 days, a whole household, not just one person. And we've just got in the last few minutes more details on those people who need to be extra careful and really do need to pay attention to the guidance tonight. The expected conditions, heart and lung conditions, but also people who have a weakened immune system, anyone who's currently undergoing cancer, chemotherapy treatment, anybody who's overweight with a BMI of 40 or above, and of course, anybody.
I mean, I had
chemotherapy
and I had cancer. And I fighted it, and some people haven't, and some people lost lives of it. I mean, I got asthma as well.
Kate, for now, thanks very much indeed. Well, the French President Emmanuel Macron has announced that France being locked down from tomorrow, and that the European Union will simultaneously close its borders to incoming travel for the best part of 30 days.
Dès demain, midi.
From tomorrow lunchtime and for at least 2 weeks, transport will be heavily reduced. And what that means is that family meetings will no longer be allowed. To wander around and meet your friends in the park or in the street will no longer be possible. So we are talking about limiting one's contact as much as possible outside the household. Everywhere throughout France, in mainland France and abroad, you must only carry out necessary trips to go and do some shopping, but shop in a disciplined fashion and keep at least a distance of 1 metre, not shaking hands, not kissing, necessary trips to look after your health, and necessary trips to go to work when it is not possible to work remotely, and also to carry out a bit of physical activity, but once again, without meeting friends or family.
Let's turn to our Europe correspondent, Adam Parsons, who's in the French city of Lille for us tonight. Adam, welcome to you. I was tempted to say, if it smells like a curfew, it looks like a curfew, then it is a curfew. We're not quite there yet, actually.
Well, technically not, but it's a social curfew. We're not at the point where, right, 6 o'clock, everybody off the streets. But it is from midday saying you cannot go out of your house without good reason. And I think the crucial bit here, symbolically, is that there will be penalties for those who go against these new regulations. And interestingly, even if it is just providing support, getting people to hospitals, the military are now being mobilised in France. So you are going to have the police patrolling the streets, you're going to have military involved, and frankly, restrictions, strong restrictions on people's movement.
France military and police are patrolling the streets.
The idea of fraternity,
by tomorrow, I think.
This is going to feel like a big step change. And Emmanuel Macron made no effort to play down the significance of this. He said, I think 5 times, we are at war. He called this a health war against an invisible enemy, but he again and again raised this rhetoric of war. And he started, I should say, by actually criticising French citizens who had not done enough to keep away from vulnerable members of society, and said that effectively France was left with no option but to go for these more draconian measures. And already I think you are seeing the result. Look, there's no one here. Lille is a pretty big town, but you just don't see anyone walking around, and it is going to get quieter. I was in Paris just a few days ago. It was quiet then, and it is frankly going to get more and more quiet. Now, he did mention borders. He did mention that the Schengen area would be closing its borders. He slightly, I think, jumped the gun there. France will be closing its borders at midday tomorrow. There is, in fact, a meeting of the European Council by video conference. That meeting won't start, so I understand, until 5 o'clock, where a proposal will be discussed to close all of the external borders of the Schengen area, and indeed invite countries like the United Kingdom to join in that as well, to effectively close their doors to people from outside Europe for a period of 30 days. This, the brainchild, it would seem, of Ursula von der Leyen, the President of the European Commission, and partly driven by politics, because she is looking at Europe at the moment. She is seeing barriers going up. She's seeing countries making their own decisions. They are going off in what she said is an individualistic way. She wants people to act together. She wants a pan-European response. She would say, though, this is about pragmatism, that actually this is about getting medical supplies and food across Europe swiftly and not having them stuck at borders.
Adam, thank you. Bringing you a special hour-long edition of Sky News at 10 tonight. Hannah Jones, our team of correspondents too, they'll have coverage analysis of what's turning out to be quite a momentous day for the COVID-19 pandemic. Do try and join us if you can. That's from 10 o'clock. Also, just to mark your card, special after that special programme, bringing you the first look at tomorrow's papers, our press preview, 11:30 tonight. Joining us will be the editor of the Times Literary Supplement,
Invisible enemies,
and the journalist,
which I can agree with. It's an invisible enemy killing people.
This is Sky News Tonight. Coming up, we'll be speaking to Justine Greening, the former International Development Secretary who led the UK's response to the Ebola outbreak.
Well, guys, I think you've all enjoyed this short video. Give it a like, give it a comment. And I shall catch you guys in the next video. Thank you for joining me. And yeah, see you next one. Peace. And hit the notification button, like, comment, subscribe.